Hi, I'm Dr. Mihir Gharia and I head medical affairs at TatvaCare. Today, I want to address a growing shift in evidence generation, one that's becoming central to both clinical decision making and market access in India. That is real-world evidence. Randomized controlled trials, as we know, remain the gold standard for establishing efficacy, but they often miss the bigger picture. They exclude complex cases, overlook patient diversity, and rarely reflect the practical realities of Indian clinical practice. That's where the RWE steps in. It bridges the gap between controlled research and real-world patient experiences in daily life. And in a country like India, that context is everything. RWE enables us to understand how therapies perform across varied demographics, urban, semi-urban, and rural. We see how patients adhere to treatments, how physicians modify dosing, and how outcomes evolve over real time in real-world conditions. For pharma companies, this isn't just about insights, it's a strategy. RWE helps establish India-specific clinical value, builds trust with prescribers, and strengthens the case for inclusion in formularies and insurance reimbursement. But we must be careful. A poorly executed RWE study does more harm than good. Here's what we see frequently that may go wrong: incomplete or unstructured data, retrospective designs that don't match real practice, manual errors in validation, and most commonly, lack of alignment with local clinical workflows. With Evalus, we address these challenges head-on. Evalus AI ensures AI-driven data validation, protocols that are optimized for Indian care pathways, incentive-led adherence tracking, and output that's ready for regulatory and publication-grade review. In India, cost effectiveness and clinical relevance drives adoption. Real-world evidence allows us to demonstrate both. Let's not treat it as an afterthought. Let's execute RWE with scientific accuracy it deserves, because that's what builds real trust in a real world.